Everyone, welcome back to the channel. If this is the first time you are coming across my channel, you are highly welcome. For my returning subscriber, thank you so much for always coming to watch my video. I come across this beautiful government hospital, Legon General Hospital in Ghana. When I saw this hospital, I was so amazed how beautiful, big this hospital look. It's located in the Greater Accra region of Ghana.
With patients arriving, a waiting area that is more than half full, and ward beds occupied, the university...
When I saw this hospital, I think this hospital is one of the best government hospital in West Africa. Because look at that, that is beautiful. I remember a few months when I went to Nigeria, the challenges I have, it was something else. Let's take a look at this video.
Ghana healthcare service is way better than Nigeria healthcare. Nigeria is a big country, but there is nothing working in this country. Nothing. Before you get one particular thing done, they will drill you and exhaust everything, every juice that is left in your body before you get one thing done. This is what happened to me 3 days ago. My little niece of 13 years was not feeling well. We took her to the hospital. That was like 6:30. There was no doctor at the hospital at that time. There was no doctor at seats at that time. We took her home and went to the pharmacy to buy some medication. So I wake up, that was yesterday, 8 o'clock, to go back to that same hospital to take the little girl there. There was no doctor on seat. A lot of people were waiting. Mothers were waiting, fathers were there, little children were waiting for one doctor to come to attend to the people, but there was no one there. This man later come along. We waited from 8 o'clock till 11. I was fed up, I have to say. You know what? Let's take this child home. We left without seeing the doctor. So my dear, this country is just big. But there's nothing working in this country. Before you get one thing done, you will sweat for what you just go and get done. With your money, you will sweat before you get one particular thing done in this country, Nigeria. Seriously, it's not a joke to live in this country. Respect anyone living in Nigeria because they are really passing through a lot of stress. Oh my God. I was so angry yesterday, like I have never been to any organization or hospital in Ghana and I will be waiting for one doctor to attend to me. I've never been.
From the video we just watched right now is when I was in Nigeria and my niece was not feeling well. I have to take her to the hospital. And when we get to the hospital, it was 6 o'clock in the evening. There was no doctor on seat to take care of her. I took her back home. The next morning I took her there. There's still no doctor to take care of her. So why can't we have something like this in Nigeria? At least, why can't something is working? Even though the hospital I took my niece, if you see this government hospital, there's nothing working there. Even the room, the air you breathe in that hospital self can give you more sickness. But look at this hospital, very clean, neat, put in order. Let's go back to the hospital to see what more they have in the hospital.
The staffing position now, we've been able to get, about 775, out of which if you look at the category of staffing, we have about 36 consultants. That is specialists. Out of these 6 consultants, 25 senior specialists. And the definition for the vision of this facility is to have this set of specialists to run the affairs.
Yes, I'm enjoying my stay here. I think I'm privileged to work in a world-class medical center, so I'm really enjoying my stay here.
In one of the theaters of the University of Ghana Medical Center currently, a team of doctors or surgeons are racing against time on an operation. This particular procedure is to remove an ovarian cyst from a patient. Emergency department. Here, patients are checked and stabilized, then moved to the ward.
Normally we have a bed on standby, prepared late. So we receive them into the bed, that is the trolley, or into the wheelchair. And whilst the patients are in, we triage. We triage here. Triage is based on the patient's, how we respond urgently to the patient's care. So based on the patient's score color, we either triage here or we send the patient to the resource room. So as you can see, we have one of the best resuscitation rooms. We have the bed for resuscitation, that is our ventilator, and most of the monitors that are needed for resuscitation. So we have the emergency physician and a team of emergency nurses, pharmacists, lab technicians, intensivists, all coming in. When the patient has been stabilized after resuscitation, we send them to the red area, which is the ICU of the emergency department, till they are transferred to the ICU, or they are sent to the main ward, where they are also later transferred to the ward after triaging.
You have visited your primary service and then the malaria is a complicated one, then maybe you'll be referred here. But we will encourage that if you have any secondary condition like a diabetic or hepatitis or anything, that we have all these subspecialists here. And so nothing stops you from deciding that, look, I want to see the cardiologist, I want to see the diabetologist, I want to see the gastroenterologist on the walk-in. So we have a combination of referral cases as well as walk-in.
He has additional responsibility of championing research and training. When the idea of building a hospital on the University of Ghana campus was mooted, it was supposed to offer practical training to medical students as well. That is why the facility now has a training and simulation center for pre-service health professional students to experiment in a realistic but risk-free environment before encountering real.
Can you see what I'm talking about? Is this not beautiful? Who would not love to see something like this in his country? Who would not love to see the system working like this in the country? In Ghana, when you are ill, you are free to go to the hospital, the government hospital, and you'll be well taken care of. Because there's a system working. But in Nigeria, there's no system working in the first place to even take somebody there. Yes, there are good quality hospitals in Nigeria, but it's made for some people. It's not for everyone. But this one, can you believe? This is a government hospital that is available for everyone. Not the rich, not the poor. Everybody can literally go there and get yourself treated and you'll be fine. If you go to a hospital like this, you will get well very fast because the environment is clean. Everywhere is well organized. There's no weird smell. There's nothing like looking unkept. Ghanaians, you are lucky. Kudos to everyone. All Ghanaians, tell me why you're not going to be proud to be a Ghanaian when you see these things in your country. drop your comment and tell me if there's another hospital that is more beautiful than this in your country or in Ghana. I want to see more because I want to see more hospital we have in Ghana. Thank you for watching the video to this end. I will see you in my next video. Stay on the research of the hospital because I want to know more about the hospital